welcome to our virtual World AIDS Day celebration. Today is a day when we celebrate the many lives of the people who've passed from HIV-related illnesses. But it's also a day when we celebrate all the hard work we've been doing to end the HIV epidemic, to care for people living with AIDS, and to make an impact in the Houston community. Here in Houston, we know a little bit about resilience. And today you'll hear from patients and healthcare providers and supporters about Avenue 360's mission. You'll hear about what we've been doing to care for people living with AIDS, to remember those who've passed away from AIDS, and the work we're doing right now to end the HIV epidemic. I hope you enjoy. Welcome.
I knew one of the people we believed to be one of the first individuals to succumb to AIDS in Atlanta in the summer of 1981. And he went from being the pinnacle of health to gone in a matter of a month. And it just blows me away, the number of people, the people I think of that, I've known, I dated, I would hang out with, that are no longer with us and were taken much too soon. A very close friend of mine who had been living with HIV since 1992 at least, ended up going from respite care to hospice care. I can't say enough about the warm, cautious, loving care that Sandy and Gloria and Lindsay and Claude and all of the volunteers provided my friend while he was there. This World AIDS Day is a sacred day in my mind to recall the people we've lost, and also to honor the people like Omega House and Avenue 360 who care for people in a very, very critical moment of need.
Hello. I wanted to welcome you to Omega House. I'm Gus Kruke. I'm a physician, and I've been the medical director here, I guess almost about 20 years, coming up on 20 years. And I wanted to show you the place. Come on in. So Omega House is a residential hospice. It was the first licensed hospice in the state of Texas. And the way that all that started was with a lady who opened her heart, her mind, and her soul to those who were dying of HIV/AIDS in the late 80s. And she brought people into her home, her personal space. Her name was Eleanor Munger. And she ultimately gave property to the organization, and Omega House became a formal entity, which moved over here, which is an 8-bed residential unit. This is our reception area, and we have a couple other things I think you might enjoy seeing. We take care of patients that are at the end of life with HIV/AIDS. Some of the patients that we have occasionally do not have HIV. They might be members of the community who have just contributed greatly, and we want them to be here where we can take care of them as their time here on earth is coming to an end. But we primarily love to take care of those who are at the end of life with HIV/AIDS, because that's what we do best. So as we come into the building, upstairs are some offices, and to the right is Sandy Stacy's office. She is a wonderful, amazing nurse, and she's our nursing director here, and she runs the place. She's fantastic. As we come this way, if we go all the way down to the end, there's a restroom, and there's a room to the right where guests can stay overnight. If we have an actively dying patient, it's important to us to make sure that the family and the loved ones are there at the bedside if they so wish. So we're going to go into the patient care area. So in COVID times, I'm going to put on a mask and have all that appropriately done. And we'll come back into the patient care area where we have our 8 beds. And if you gaze down the hallway, you can see that they are really more like bedrooms, where patients have the ability to have their privacy, to have a shared adjoining bathroom, and a very home-like situation where there's a hospital-type bed which functions in that capacity and allows us to make sure that we do everything medically and spiritually and socially and mentally that's required for somebody who's coming to the end of life. So we'll move back towards more of the patient care area, and to our right is the nursing station where we keep our medications and where the wonderful nurses and volunteers collect and do what they need to do to keep our patients comfortable here at Omega House. As we go further in, we come into a common area where patients will often gather together and watch TV, watch a movie. We have a wonderful dining area and a huge kitchen so that patients can have anything that they want 24/7. We have wonderful volunteers here who help the nurses and assist with the care of the patients. And this part of our community is what makes Omega House so great. We rely upon you to help us in this mission. Over to your right is a patio which patients will often use to sit out and if they feel comfortable, especially when the weather's nice. So walking back into the gathering area, we have another patio area and then a meditation room over to the right, and then swinging on to the left into the kitchen is a full functioning kitchen for which we have a number of people who volunteer and come and cook for the patients and for the staff. And we're very lucky to have this type of facility and service for the patients who are here.
He was really funny. He was one of the funniest, most fun people you would meet ever in your life, probably. And I will never forget the day that I was at his house and had seen some of the medications. And I knew what they were, but I had a feeling he wasn't ready to talk to me about it, so I didn't ask. Well, he realized that I must have seen them, and a look of fear on his face really struck me because he was afraid that I wasn't going to be his friend anymore because I found out that he was HIV positive. And that shattered my heart. And that's when I realized, okay, more people need to know the truth. They need to know that we can be friends, like we can go about our lives and be normal and have those types of interactions. And there's nothing to be ashamed of. There's nothing to be embarrassed about. But really, seeing the look on his face and the fear when he was telling me that he was HIV positive really just let me know that we have a lot more work to do as far as removing the stigma. Because I gave him a big hug and I was like, it doesn't matter to me. It does not bother me one bit. So, but he was a lot of fun, and I will miss him forever. On this World AIDS Day, it's important for me to remember those that we've lost, including my friend that I lost. But it's also important that we look forward and we look to the future and how we can utilize science and medication to help completely eradicate the virus and really ensure that we are taking the best care of our people.
Hello everyone, I'm Dr. Mark Nichols. I'm the Dental Director for Avenue 360 Health and Wellness, and I wanted to share some thoughts with you about World AIDS Day and what it means to me. I started working in or providing oral health care services to people with HIV back in the late 80s. And I have seen a whole lot of really horrible things happen to people with HIV. I've seen a lot of lesions in the mouth and a lot of really tragic things. And I've lost a lot of friends and patients to HIV. And on World AIDS Day, I like to set aside some time and think about my friends and patients that I've lost and remember them and honor them. I also like to appreciate how much we've advanced in the treatment of HIV, and to think that, now you can just take a pill and have a undetectable viral load, and I think that's just wonderful. It's just so refreshing to think about that. And I also want to share with you how important it is to take care of your mouth. How oral health is really, really important, to be able to eat and smile and be comfortable. And so I want everyone to take really, really good care of their teeth, brushing and flossing, and seeing the dentist. And I just want to thank everyone for the awesome experiences it's been for me to take care of HIV patients in the past 30-something years. Thank you so much.
On this World AIDS Day, we unite with others across the world in our commitment to continue fighting against HIV, to show support for people living with HIV, and to remember and commemorate our loved ones who we lost throughout the years. My name is Oscar Perez. I am the Director of Health Promotions at Avenue 360. I've been able to call Avenue 360 home for nearly 13 years, and in my time here, I've worked with a team of dedicated professionals with one shared commitment: ending the HIV epidemic in Houston. In our work, we provided HIV prevention and educational tools all over Houston, including jails and correctional facilities, bars, and drop-in centers. We have established wellness programs at Texas Southern University and at the University of Houston. The science has gone from having to draw blood and waiting 2 weeks for an HIV test to now receiving results in less than a minute. We now know that U equals U, which means that when a viral load of a person living with HIV is undetectable, it is untransmittable to their partner. We also know that there's a daily pill that prevents HIV. We have every weapon in the toolbox to ensure that our community stays healthy, whether you're living with HIV or not. And that's what motivates me. The South accounts for 51% of new HIV diagnoses. We can no longer have the same copy and paste approach that we've had for years, and the time for innovation is now. COVID-19 has created a unique challenge for prevention and treatment for HIV. The virus has caused a disruption in some of people's routine preventative care. We now want to make testing as convenient as possible and are excited to have launched our drive-through rapid HIV testing experience this fall. We're also beginning our at-home testing initiative where you can test yourself for HIV with the virtual guidance of our staff in the comfort and safety of your home. In our clinic setting, we will work with eliminating HIV-related stigma by normalizing HIV testing through our opt-out testing approach. We will work on a status-neutral mindset, meaning that regardless of your HIV status, we will make sure that you start on HIV treatment and HIV prevention, such as PrEP, as quickly as possible. Despite the great progress made since the early days of the epidemic and being able to transform HIV from a fatal disease into a chronic and manageable condition, we've lost too many people along the way. We care for the entire person at any stage of their life journey.
And when you find out, or if you find out, that you are diagnosed with HIV, your life still continues and you can still have a normal life. That's what I want people to know. It's not something that you have to be worried about every single day of your life. No, you don't. You can do everything you need to do just like anybody else. I want to thank Dr. Garza for always, showing his support, making sure he's always telling me what I need to do, how to stay healthy, what medications I need to take, and if I don't need them, take them off. And he's definitely there, shows that he does care for me as a patient and wants to make sure that I live a good and healthy life.
Thank you to Dr. Nichols, Dr. Kruki, and to our lead HIV doctor, Dr. Juan Garza. They are legend in the field of HIV care in Houston. I also want to thank all of our team members who spend time each and every day caring for the community of people living with HIV and AIDS. When I think about HIV in Houston, I reflect on the fact that most new infections occur amongst Black and African American men between the ages of 25 and 34. But today I want to take a moment to reflect on two patients that really impacted my life as a physician. One is a 31-year-old young woman who died way too young of an HIV-related cancer. And the other was a 41-year-old woman who took 15 years from the time of diagnosis to engage in care. She became so depressed that she wouldn't get out of bed, and when she finally tried to get out of bed, she couldn't. Ultimately, despite engaging in care, she passed away. It's this type of heartbreak that you and I together can stop. Because today, right now, in Houston, Texas, we have all the tools right at our fingertips that we need to end this epidemic. We have access to testing. We have access to preventive care, including a medication that's 1 tablet once a day, that's been FDA approved since 2012, yet only 10% of the people who need to be on it are on it. So many people don't know that here at Avenue 360, they can access this medication and they can access caring providers who can prescribe it to them and walk with them through the process. I encourage you to come out to one of our locations to get an HIV test, including a drive-through testing site at our Southwest location. I encourage you to come and have an appointment at one of our locations, where in this season of COVID in 2020, we're doing everything we can to keep our patients and our providers and our team members safe. My biggest concern in this era of COVID is that people will use the COVID pandemic as an excuse to not get HIV care or to not get care for their diabetes or their high blood pressure. But today on World AIDS Day, I want to remind everyone that you can get the care that you need. You can get the HIV testing, you can get access to medication, and you can get access to treatment. So as we work together to beat COVID, let's also work together to beat HIV and to get people the care that they need. Happy World AIDS Day.